So I have decided to do my case study on a patient that I have been working with for a couple of months now. We're going to call him Sam. He's 77 and he's a male. And he has been coming to my clinic the clinic that I work at, since about January, because he was rehabbing from an ankle injury. And he was there for about 2 months, and I was one of the main techs that was working with him, and he made tremendous progress in the clinic, but occasionally he would complain about some pain in his right knee and kind of joke about needing to have a total knee replacement done some point within the near future because he said it was causing him a lot of pain. So the diagnosis for his condition was he went and saw multiple doctors and got multiple opinions to make sure that he was making the right decision. And he said that he had a total knee replacement done at the beginning of June by a doctor that was in the hospital for the clinic that I work at. And then those doctors all come to the same conclusion that he saw, and he needed a total knee replacement because of his inability to do his daily activities. So Sam had complained about having pain in his knee during his day when he would go about walking downstairs, doing household chores, standing for extended periods of time. And one of the things the doctors found when they did an MRI on his knee was his shin was kind of breaking down with the pressure that his knee was failing. So his shin was breaking down, so he was having pain in his knee and in his shin, which caused for doctors to come to the reason that he needed the total knee replacement done. So a couple other things of his symptoms were his knee was stiff in the morning when he got up, and then he had some swelling and pain, and the knee kind of bowed out and wasn't exactly straight, up and down as it should be. So he went and got some opinions, and they said that he needed a total knee replacement done. He also was in a lot of pain that prevented him doing sleeping. He wasn't sleeping good at night, and his knee didn't feel stable, so he was using a walker and a cane to get around the house. And he also had a lot of swelling and inflammation just due to the pain and inability to move his knee, because he said that whenever his knee started hurting really bad, that he wasn't able to, he didn't want to move a lot because his knee hurt. And so he didn't continue doing his daily activities because of how bad the pain in his knee was. So that kind of raised an eyebrow, and said that he kind of thought about going to doctors and see what all they could do. He got some injections done to try to help the pain and the inflammation, but that didn't help either. So the doctors all come to the same conclusion that he should get a total knee replacement done. He got the total knee replacement done at the beginning of June, and he's been coming to the clinic ever since then. And he, in the beginning, he did an eval with one of our main PTs, and they kind of set up his plan of care, and then one of the PTAs starts working with him more closely, and she walks him through. He gets on the bike usually when he starts to kind of warm up everything, and then he'll go to the table and do exercises like straight leg raises, his bending, long arc quads, short arc quads, mainly just trying to strengthen that quad, because also after surgery his quad did kind of shut off for a little bit and stop working. So he's really been working hard and doing some of the E-stim. Electromagnetic stimulation was done, some therapy, so he could get some feeling and motion regain in his quad, because he wanted to be able to progress sooner versus later because of how that was progressing. So some of the things he also does along with the straight leg raises and the therapy are step ups, and then from 4 to 6 to 8 inch boxes, marching in place with weight on his ankles, and then abduction, adduction on hip machines, the hamstring curls, standing, and then he's recently progressed to sitting in a hamstring machine and doing it with weight, probably around 30 pounds. He has also been doing all of his exercises in the PT, and then he goes home and he does all of his exercises at home. But the one issue is that he has back pain, and his back pain prohibits him from doing some of his exercises, so we kind of have to gauge how he's feeling that day as to how we kind of go along with his plan of care and help him progress at the speed that he needs to be progressing. And the PTA has helped him tremendously so far. I think he's probably about at the halfway point, so he might have about a month or a month and a half left, maybe even 2 months. But he's getting the bending and the straightening done, so I think he's doing a great job. And I've seen other patients come through that have done this total knee replacement program, and they've succeeded and gone back to normal life, had no pain. That's done awesome. So I'm really proud of how all that's progressing.